Hi, my name is Eugenia K. Taylor, and I'm with Health Assessment Class 2, and I'm going to be doing my head-to-toe assessment. Today, I have my patient, and she's in my bedroom so we can promote her with privacy. My name is Kay, and I'm going to be your nurse to do your head-to-toe assessment. Would you like me to call you Beverly or by your last name?
Beverly's fine.
Okay. I'm going to wash my hands so we do not spread any germs. And the first thing I'm going to do is do your vital signs. Okay, your blood pressure is 120/70. Your heart rate is 84. Respirations are 20. Temp is 98.6. And your pulse ox is 99% on room air, which is all within normal limits. Okay. Can you tell me, where are you at?
I'm at Kay's house in Benton.
Okay. What is today's date?
Today is November the 23rd, 2016.
Okay. And who is our newly elected president?
Trump.
Okay. She is oriented ×3. Okay. First thing I'm going to do is look at your skin. I'm going to look for any obvious lesions, bruises, any deformities. First thing I see, her hair is evenly distributed on her skin. Her skin is warm to touch. I'm going to palpate for any tenderness. You tell me if any of this hurts. Okay. I'm going to look at your fingernails. Capillaries are less than 3 seconds. There's no clubbing and her nails are translucent. Okay. Next thing I'm going to do is look at your skull. It's symmetry. I'm going to palpate for any tenderness, any lumps. Does any of this hurt?
No.
Okay. Your eyes are the upper third of your face. There's symmetry with your tips of your ears. Your nose is midline. Your mouth is symmetry in the middle of your face. Yay. Okay. I'm going to check your carotid pulse. Okay. Turn your face this way and I'm going to palpate. Okay. Hold that position. I'm going to listen with my bell. Take a breath. Hold it. Okay, good. Right, turn your head this way. I'm going to palpate. Feel it. Okay, and I'm going to let you hold your breath. Okay, good. Her carotid pulses are strong and equal in regular rhythm without any breaths. Okay, the next thing I'm going to do is palpate her lymph nodes. I'm going to use the pads of my fingers and I'm going to do a circular motion. First thing I'm going to palpate is the osticle, the post-auricular, the pre-ocular, the tonsillar, submandibular nebula, submental, the superficial clavicle, and the post-clavicular supral. Okay. Next thing we're going to do is look at your eyes. And where is my pen? You're right here. Okay. I'm going to look at your pupils. Okay, your eyes are reactive to the light. Your ears are symmetry with your eyes. It's got a video record. You got small amount of cecum in there. I noticed piercings on your lower lobes. And I'm going to palpate for any tenderness. I'm going to palpate the post-ocular, the trigeminus, and 1 second. I'm allowed to look at one thing. The ocular, the trigeminus, and the mastoid process. Okay. I'm also going to palpate her sinuses, the maxillary. Tell me if any of this is tender. And the frontal. Was that tender? Okay. I'm going to look in your nose. It appears to be pain. Okay, put a finger over one nostril. Take a breath in. Okay, and the other nose. Both nostrils are patent. If we want to do an olfactory sensation at this time, we could put coffee or cinnamon under her nose and she could describe what she's smelling. Okay, open up your mouth and say ah. Okay, I'm looking at her mouth. The uvula is midline. Her tongue is pink. The palate is pink. Her gums are pink. Mucosa is pink. Teeth are intact. Lift up your tongue. Fangs are intact and saliva is intact. Alright. Lungs. I'm going to look at your back. First of all, your back, I notice it's an S shape. It's midline. I'm going to feel for any crepitus. Tell me if you feel any tenderness as I do this. Any tenderness?
No.
Okay. I'm going to put my hands on your chest. Take a breath in. Take a breath out. Equal expansion. Okay, I'm going to auscultate breath sounds. Okay, take a breath. Let it out. 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 I'm also going to do the front. I'm putting you asleep. Take a breath. Let it out. 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 All breath sounds are clear to auscultate. Okay, I'm going to let you lay down. We're going to take, let me help you there. I'm feeble. No, you're not. Okay, I'm going to just raise your shirt up just a tad. And we're going to look at your cardiac system. And I'm going to be looking at the intercostal sternum, the right sternum border, the left sternum border, the mid-clavicle line, the abs point. This is where the S2 can be heard the best. The tricuspid is on the left sternum, and the mitral is on the intercostal and the mid-clavicle line. Okay, I'm going to listen. Okay. And I am listening to the right sternum border, left sternum border, the mid cervical line, the ab point, the tricuspid on the left sternum border, and the mitrum on the mid clavicle line in the fifth intercostal spine. And as I listened, the rhythm was regular and no extra sounds was heard and no murmurs. Okay, next thing I'm going to be looking at your tummy. Okay, we're going to look, and first I noticed she does have striae. Her umbilicus is midline. Her it's inverted. Looks like she's got a couple of raised areas here. The next thing I'm going to do, I'm going to listen for vowel sounds. The normal is anywhere from 5 to 20 per minute, but I will not be counting them. Vowel sounds is rated as hypo, hyper, or normal. Okay, her left quadrant, left lower quadrant, right lower quad, and the right upper quad. Vowel sounds are present in all quadrants, and they are normal in sound. All right. Next thing I'm going to do is I'm going to palpate. I apologize. Okay. You inspect, you listen, and you palpate. And I'm going to palpate for any tenderness. The right upper quadrant, I'm feeling for the liver or the gallbladder. Is that tender?
No.
The right lower quadrant could be your appendix. The left upper quadrant is the spleen. And the left lower quadrant is the descending colon. Okay? Any tenderness when I done that?
No.
Okay. Okay. I'm going to look at your peripheral vascular now and check that system out. Okay, on your right side, just a slight amount of edema is noted. Skin's warm to touch. Small amount of hair evenly distributed. The tibia pedis is intact on the left and on the right. The dorsal pedis intact on both. Okay, I'm checking capillary refills. Less than 3 seconds. This leg here, I do not see no edema. Okay, on her arms, again, I'm feeling for the temperature. It's warm to touch. The skin, the hair is evenly distributed. I'm checking her radial pulse on the right. It's intact at a 2. And pulse at a 2 on the left. Her brachial pulse intact around a 2. And on the left, brachial is on a 2. Okay, and this concludes my head to toe assessment.